Hi guys, I'm Dr. George Michael. I'm a doctor, first choice homeopathy. We have three branches: Bangalore, Mangalore, Udupi. Today my subject is scope of homeopathy medicines in varicose vein and varicose ulcers. What is varicose vein? It's a dilated or swollen veins in the lower feet or lower leg. Okay, appears as twisted or bulging or cord-like appearance of lower legs. How it causes? Usually weakened or damaged walls, otherwise tear and wear in the walls in the veins, that causes the backflow of blood flow to the veins, where it collects, okay, it dilates, okay, it twists and forms like a tortoise veins. So what are the conditions? Who are the risky people? So especially it's most of the seen in the profession engaged in long standing, just like traffic wardens, teachers, medical professions, okay, and especially those are ladies, those are hormonal changes which dilates the veins. Third thing is the pregnancy time, because of high demand of blood supply in support of the fetus, that causes the compression on the veins. Third thing is obesity and family history. These are the risky people we are common seen. What are the signs and symptoms of these conditions? It has come to certain stages. In the beginning stage, aching, throbbing pain, heaviness sensations, skin discoloration, either could be dark, blue, purple appearances. So these are the warning signs in beginning. So this issue should be cosmetic trouble, otherwise serious trouble. So what happens when you neglect these cases? There are major three complications going to happen. One thing is we call varicose ulcer. It's often a bit confused with the diabetic ulcer. Whereas a varicose ulcer, it's a painful, whereas a diabetic is a painless usually. Second complication, thrombophlebitis. The clot from the varicose venous ulcer, it may transfer. It could prove fatal, could prove fatal to the patient. Third thing is we call varicose hemorrhage. It could be active hemorrhage or passive hemorrhage. Yes. Now, two options now, treatment part. One thing is therapeutic and treatment part. So we in the homeopathy part, we talk about the most times of therapeutic and homeopathy part also. So yeah, preventive medications like as I just example, they just don't take drugs on the counter, OTC. Oh, that counter, you don't take this, please. Lacosis, Crotalus horridus, Pulsatilla, Hamamelis, fluoric acid. These are drugs which plays very important in the curative part. Here, which we wait for these varicose veins ulcer to complicate, you will end up with the invasive procedures. Say for example, if you go to a surgeon, he'll option for the surgical, non-surgical options. So few conditions like sclerotherapy, okay, ligation, strip ligation methods, like they remove the veins and replace the healthy veins with the general anesthesia. So total focus on the treatment part is to block the veins. Yes, in homeopathy, we don't think of the blocking the veins. Here, we are focused on the treatment in homeopathy, the four focus. One thing is to improve the muscle tone which is surrounding the varicose veins, which has increased the contraction so that it has to push the blood from the veins to the blood back to the heart muscles. Second thing is to increase the damaged or weakened veins, otherwise to repair the tear and wear veins. Third thing is not to complicate the three conditions, not to form the ulcers, not to form the thrombophlebitis, clot formation, which is very medical emergency. Third thing is to prevent the varicose hemorrhage, we call active hemorrhage, passive hemorrhage. Yes, so you take up the treatment. Make sure that when you reach a homeopathy doctor, you take up the treatment for 6 months to 12 months to complete to prevent the varicose hemorrhage, otherwise varicose ulceration, otherwise to prevent the thrombophlebitis complications. So you can reach us on this mobile 8277 165971 for the further details.